Hello, everyone. Welcome to Millennium Live. My name is Katie Perry, and today we have such a fun team joining us for the podcast. I am with the care analysis team. I am going to let them do introductions for themselves. So, everyone, welcome. It's a pleasure to have you on.
Well, Katie, thank you so much for this opportunity today. Lee Clark, the president and CEO. After a career building enterprise scale analytical solutions for big tech, I wanted to focus on delivering easy to use platform for healthcare systems to provide better patient care while understanding the cost associated with that care. This will simultaneously improve both the quality and cost of care, which is something we can all use.
I'm our product manager. I have been with the company as part of this team to help lead the development from the ground up. I'm so grateful to be a part of this call today and just really thrilled to be talking about the platform.
Hi, good afternoon. My name is Kathy Anderson, and I'm actually the customer success executive, which my role is really about managing and supporting the customer in all ways possible. So I'm here and proud to say that I am a nurse. So what the calling always has been to influence that patient experience, which started a long time ago when I was working as a nurse assistant. But I've been lucky enough to continue the work in various roles and practices along the way. So with Amplion, the mission to improve that patient experience, that was one of the main reasons I joined the team, was because of the analytics. So thank you.
All right, and my name is Laura McLean, and I am the product coordinator, and I also get to head up our marketing team. My experience has blended marketing with a technical environment, which is really exciting for me, getting to work with some incredibly smart technical minds. I, on the other hand, think I've got the best job, and I get to tell our story, and I'm really passionate about the value that we bring to the table with the product.
Well, thank you, and I'm so happy that you're all here. I'm really excited to jump in and learn more about care analysis. So I'm first going to start with Lily. Do you mind just telling me what care analysis does?
Yes, I would be really grateful to answer this question because I couldn't be more proud of the product that our team has built. I would describe care analysis as an analytics solution that acts as the single source of truth within the hospital for all of the information hospital system data. It's easy to implement with, it gathers and aggregates data across multiple systems, and it centralizes all of that data into one platform, which again makes it really easy to use. I would say one of our unique focuses is on improving both the quality of care while also taking into consideration the cost of delivering that care, whether that be from the facility level up to the organization and then system-wide. And by doing that, it allows us to uncover kind of that 360-degree view at both, again, that macro level all the way down to the micro event level data, while still being intuitive and interactive for our customers. I've actually had several scenarios, even in the past couple of weeks, of getting to talk with clients where they're saying, I feel like a data scientist and I don't like data. So it's just a good testament to how we focus on that end user experience while being a broad platform with a lot of data. So overall, I would say our solution focuses on taking from one facility to many facilities to give them the tools to optimize staffing, whether that be in resource management, cost management, manage that quality of performance, while also in many cases improving patient satisfaction. Just recently, we worked with a facility to increase their HCAHPS scores significantly by using this platform. So it's a really exciting product. I'm grateful to be here talking about it.
That's great. I'm excited to learn more. So can someone tell me who exactly can use the care analysis platform?
Absolutely, Katie. I'll answer that. And the answer to that is anyone, truly. Anyone needing analytics related to the patient experience. So because care analysis provides insight from so many different perspectives, it provides value to CEOs, the CFO, or any clinical leader really. So the platform itself is super friendly and intuitive. So it allows for really quick and easy access to evaluate things like true patient demand, staff response, the clinical workflow itself, or providing analyses to optimize staffing. So it's a great tool for leaders involved in a survey process, such as JCHO or CMS. Those impending surveys have always created that level of uneasiness for healthcare leaders, the dreaded survey, right?
Mm-hmm.
So care analysis allows those leaders to be ready, be survey ready, which relieves sort of that stress of the surveyor scrutiny. The surveyor, we never know what they're going to ask ahead of time. So easily with the touch of a button, the leader can pull information related to the bigger picture, meaning like an overall response time from a hospital perspective, or they can look at a patient-specific room, even a specific event like a bed alarm. So down to that level as well. So basically, I think, care analysis is the greatest benefit is that it allows our clients to use one source of truth when they are working together toward their mission as a leadership team. And it bridges that gap of that perceived imagined work versus the actual work that's done. Really, it's a tool that I wish I had as a clinical manager.
It sounds wonderful. So I'm curious, how exactly is the care analysis platform implemented?
When we were building this product, the ease of implementation was at the forefront of everything that we did. And that really comes from our leadership team and clinical staff, such as Kathy on this call today, because they understand how it is for facilities to be disrupted and interrupted by multiple people walking around the facilities, trying to connect things. And so one of our missions was making sure that this is as seamless as possible for our clients. And this is really done through our deployment methods, which allow us to easily connect with the nurse call systems that are already at the facilities to extract that data. We've also found that we can enrich the value of that data even more with a simple box on the wall option. In many cases, our solution can be installed with little to no physical resources. So that's really done through our experienced staff working remotely to lead our clients step by step through the process to ensure it's done effectively and securely. And the best part is that we can have this up and running in about 30 days. So another thing that people ask us when they're talking about the implementation process is how do we account for some of the unique requirements that might come up? And this personally is my favorite part because it's through personalized onboarding and support. So that involves me getting to sit down with our clients and hospital leadership and talk about what kind of goals are you trying to achieve with the system? What data is important to you? How can we set these things and explain it in a way that makes sense? So that transition over to using the analytics is easy too. And really this commitment to that ease of use goes beyond just the implementation process throughout the entire lifetime subscription of care analysis, because you'll have access to clinical staff throughout the lifetime where you can set up training. And then we've also got online resources located right inside the portal. With the click of a button, you can get questions, frequently asked questions about individual analytics there. So ultimately, we do understand the difficulties of data aggregation. And that's why we have put such an emphasis on making this process really easy for our clients.
Wow, and I almost interrupted you there because I'm curious, how exactly does care analysis gather the data?
Right, so this again speaks to ease of implementation. So we actually stick to the industry standards for data connection, depending on the system. So that can be HL7 for an EMR integration, API connection tap interface, and so on. By using those industry standards, we really can combine that with my team's background, my background in analytics and cybersecurity to make sure all of this is done through the most secure connections and that the data is protected as well. And then to just name a few examples of data streams that we connect with, there's real-time location system data, that's the RTLS. We've got admit, transfer, and discharge, ADT from the EMR, and then multiple different kind of nurse call systems, just to name a few of those data gathering systems.
Wow. So Laura, I do want to bring you into this conversation a little bit. Can you explain to me how Care Analysis approaches analytics?
Yes, I love this question. There is a lot packed into it, so I'm going to try to be brief. But ultimately, our team is really passionate about these concepts. And we start with predictive analytics, which is a term you've probably heard thrown around in the industry before. And predictive analytics looks at past trends and current data, and like it sounds, makes predictions about the future. However, having an idea of where you're headed really isn't helpful unless you can implement changes and make decisions, knowing that you're encouraging trends to align with organizational goals, whether that be performance goals, quality, financial goals, probably all of the above. So that magic really happens when we build off of that with prescriptive analytics. And that's just the next level, like I said, that acts as the how, which helps clients see their decision options and take advantage of the information that is found within predictive analytics. So for example, predictive analytics might show our clients there's a consistent staffing issue around 7 p.m. when shifts switch over. Building onto that, prescriptive analytics would give the client insight into exactly where and how to optimize the ratio of staff types to make sure that all patients can receive the care that they need. So together, predictive and prescriptive analytics, this is what we're really excited about. And we've coined the term reflective analytics as that full progression from predictive to prescriptive analytics that work together. And reflective analytics really connects human behavior with data, which brings the data to life. So now evaluating historical data feeds against real time is actionable because the analytics can highlight areas of strength, areas of opportunity, show us how to get to the root cause and enact changes that really make an impact on the patient satisfaction for both current and future patients as well.
That's awesome. And how does Care Analysis influence decision making based on that?
Yeah, this is a great question as well. And one of the, in my opinion, most valuable aspects of this platform, because personally decision-making, especially decision-making involving risk, even buying a house or a car can be very nerve-wracking. I don't think I'm alone in that boat. But our data is really designed to support and validate strategic decision-making with the goal of making clients feel confident that each decision made is a smart decision and a decision that aligns with the trends and goals of the whole system. So from there, make these changes, clients can then measure performance over time and see the impact of each individual decision and then adjust future decisions based on those results. So at the end of the day, I like to think of this platform as a pair of glasses that make these data-driven insights very clear, the focus sharpened, actionable, and measurable so that clients just aren't in the dark anymore with making those decisions.
I like that analogy a lot. Lee, I have not forgotten about you. I'm going to bring you in here. Can you tell me how Care Analysis improves financial performance?
Certainly, Katie, and thank you for the question. Understanding the quality of care in the context of cost is so important, but it's only part of the equation. Care Analysis helps increase patient satisfaction, which leads to increased revenue for the facility. By monitoring that operational performance, hospitals prevent complaints, which can also prevent litigation, that identifies root cause of issues, and coming back to the decision-making, it validates that the improvements were effective. As Care Analysis can also help optimize staffing and resource allocation. This ensures the right staff is performing the right task at the right time, and that provides actionable insights into the actual level of activity required to deliver that care. With all this rich data in the system, care analysis analyzes cost. It easily pivots by such factors as staff type, the DRG, and the activity levels. And all this leads to a better understanding of how to balance quality and cost of care so that hospitals can spend more time with patients who need it most.
So, Lee just mentioned that care analysis can help prevent complaints and associated litigation costs that come with it. So, how exactly does care analysis aid clients in litigation support?
Well, of course, we hope our clients never have to deal with litigation. My team here at Amplion consists of nurses and who, like all clinicians, strive to provide the very best care with positive outcomes. So when we're notified that an event has occurred, we feel the pain right with the client. When faced with the real or perceived concern of patient harm, though, we're here to support our clients, and we feel we have a care tool like no other that can negate those costly litigation fees. So the analytics tell the story of that patient experience. In working with our clients, I've found that their investigations require details down to the minute or the second of an event or response, and there's very few resources that do this. So we provide the analytics to investigate, for example, when a nurse call button was pressed and responded to, or when an alarm for a clinical device was activated and actually addressed. Or it might be something as simple as understanding when a staff member actually was in that patient room last and assessed that patient. So, and then we complete everything with support to our clients with the analytics and providing those in various formats for presentations or reports for case files. So the bottom line, the tool provides an avenue for that leader to quickly gather that information and then take, the appropriate action.
Wonderful. So, I just have one final question, and I'm curious what really differentiates care analysis from other solutions that are on the market?
So, Katie, our team built a clinical analytics platform for healthcare systems to deliver better care to more patients. We made the platform easy to implement, easy to use, and easy to realize value by bringing together clinical experience and expertise with advanced technologies. It is our mission for hospitals to easily understand the quality of care provided in the context of the cost of delivering that care so that they can spend more of their time, energy, and resources caring for patients. It's the core of everything that we do. Today was an opportunity for our team to highlight some of the advantages of the care analysis platform, how it enables healthcare systems to deliver quality performance from a clinical perspective, and that helps them improve both their operational and financial performance. Katie, we really want to thank you for your time today and for the opportunity to share some of these advantages. For those experiencing any of these challenges, we hope to have the opportunity to talk with them more.
Well, thank you so much, Lee and Kathy and Lily and Laura. This was a great conversation, and I can't wait to chat with you again.
Great.
Thank
Thank you so
you.
much, Katie.
Thank
Thank
you.
you.